I rise today to urge each one of my colleagues to support Assembly Bill 398, although I know there's one that won't be, we just heard. But this bill relates to participants in clinical research trials. Senator Strobel and myself, we aim to clarify that an individual who receives a stipend, remuneration, or compensation for participating in a clinical research trial is not considered an employee of that business who is conducting the trial. Healthcare institutions, academic institutions, private contract research organizations conduct clinical trials with human volunteers. In early stage research, these organizations recruit normal, healthy individuals to participate in the trials. In the later stage research, these groups recruit individuals with a specific condition or disease to participate in those studies, and it allows them to test the efficacy of the new product. Now, I was made aware of the issue of the classification of clinical research trial participants recently by a contract research organization right in my district. I was surprised when I learned that the Wisconsin Department of Workforce Development believes participants in clinical research trials are employees and not independent contractors. I can't imagine a scenario in which someone who is clearly an independent contractor would receive unemployment insurance based on their participation of the study. It's critical to ensure that this misunderstanding does not happen again by clearly codifying what clinical research trial participants are with respect to the minimum wage law, workers' comp law, and unemployment insurance law. The requirements of the agreement with clients, both biotech and pharmaceutical companies, prohibit contract research organizations from using their employees for clinical trials due to the conflict of interest it would create by allowing participants to be classified as employees. That would put Wisconsin clinical research organizations at a very big disadvantage with similar entities operating outside of Wisconsin's borders. This is especially noteworthy given that Madison has recently become a preferred destination for the biotech industry. Participants should not be able to seek compensation through Wisconsin's unemployment insurance fund because the trials are temporary, and the individuals are aware of that before they begin. These trials often occur over a span of just 3 to 4 days, if not less. Mr. Speaker, the lawmakers of this body all share a common goal, and that is to see Wisconsin at its very best. We all would like to see business investments in America's dairyland from new companies and organizations from outside state lines. Wisconsin's biotech sector is noticeably increasing in size year after year. So I want to ensure that we continue to receive investment in that sector and that we see Wisconsinites participating in life-changing medical advancements. Thank you, Mr. Speaker, for the opportunity to speak on Assembly Bill 398. The vote is green.